Good medical morning. This is Watson, and today we're going to talk about oral thrush. This is oral candidiasis, also called oral thrush, which is caused by a fungal infection involving the skin and mucous membranes. The causative agent is Candida albicans, which is actually an asymptomatic inhabitant in half of healthy adults. In healthy individuals, Candida exists harmlessly in mucous membranes, such as your ears, eyes, gastrointestinal tract, mouth, nose, reproductive organs, sinuses, skin, stool, and vagina, etc. It's known as your beneficial flora and has a useful purpose in the body. When an imbalance in the normal flora occurs, it causes an overgrowth of Candida albicans, which may lead to an opportunistic infection. The mucosal surfaces primarily affected by candidiasis are the oral cavity, esophagus, angles of the mouth, and genitals. Overgrowth of Candida is protected against by local T cells and interleukin-17. Thus, when immunity is compromised, growth proceeds unchecked and leads to infection, notably in patients who are on immunosuppressive therapy, infected by HIV, or have diabetes. Candidiasis in the mouth, throat, or esophagus is usually treated with antifungal medications. Leave a comment below. Have you known anyone who has suffered from thrush? What caused this condition? How is it treated in your experience? Please join the discussion and talk to other fans below.
I would like to tell you about Rest More, an all-natural sleep aid designed to help you fall asleep and stay asleep. If you're looking for a great natural way to get better quality sleep, please visit buyrestmore.com. Thanks for watching. There's an Amazon link below.
Restmore is an essential addition to your medicine cabinet for those times you need to fall asleep but can't. Remember, when you just need more rest, get Restmore. Now available on Amazon. Good night.